Welcome to Hands on Health, the podcast all about living your healthiest life on the coast. I'm your host, Felicia Struve. Did you know that quitting tobacco is as good for your health as losing 100 pounds of extra weight? I didn't. Join us for episode 6 of Hands on Health as I chat with Alissa Dorman, an expert on quitting tobacco. Alissa is the Tobacco Cessation Coordinator at Columbia Memorial Hospital. If you or someone you care about smokes, vapes, or chews, this episode is for you. So I'm joined today by Alissa Dorman, who is the Tobacco Cessation Coordinator at Columbia Memorial Hospital. Welcome, Alissa.
Yes, thank you.
Alissa, can you tell us more about what you do at the hospital?
Yeah, I'm a certified tobacco treatment specialist, and I see inpatients here within the hospital to offer nicotine replacement therapy to them and sometimes assess whether they're, wanting or willing or considering maybe working on quitting tobacco. I also see individual face-to-face appointments or via the phone for tobacco cessation services too, for those that are wanting to quit or learn more about that.
Okay. So cessation meaning simply stopping.
Yes, quitting. Yes.
Quitting. Okay.
Yep.
And we're talking today because there's an event coming up later this month. Can you tell us about the Great American Smokeout?
Yeah, the annual Great American Smokeout's always the third Thursday in November. So this year it's on November 19th. That is an annual event that started in the 70s to encourage people that use tobacco to try to quit, at least for the day, in hopes that that day will turn into more days and weeks and months and that sort of thing. And sometimes people use it as a quit date as well.
So just a nice day to jumpstart your new habits.
Yes, yeah, exactly. Or a time, a day or consider working on quitting.
For people who use the Great American Smokeout to quit just for that single day, what does it matter? It's one day. How does one day make a difference?
Yeah, well, it's never too early, it's never too late to quit. And even if you quit for a day or two at a time, your heart rate drops, your nicotine levels in the blood go down, and your heart rate drops within minutes. So there's very quick effects that show up within minutes, days, and weeks after you quit. Coughing and shortness of breath decrease. Your endurance increases. You start to breathe better, feel better, taste and smell improves, quickly. And every quit attempt gets you to that final quit because you learn what works, what doesn't, what you should do, what you shouldn't do, and that sort of thing. So even if you're quitting just for the day, and maybe then you'll consider continuing that the day after.
Yeah, just day by day building that new pattern.
Yes, exactly.
So what are the barriers for a lot of people for quitting?
Well, I think it's scary. It's a huge addiction. It's a huge habit. A lot of people have been smoking for 20, 30, 50, 60 years. And it's a huge lifestyle change. Some people refer to like a cigarette or whatnot as their, best friend. It's always with them. It doesn't talk back, and it's just ingrained within your daily life. So it's a scary thing. Most people do want to quit. Most people wish they would have never started. Now it's taking the next steps in maybe pursuing that a little more on at least considering quitting or looking at those options.
So I know for some people in my family, one of the barriers to quitting is this perception that they are, and in some cases, reality that when they have quit before, they've gained weight, and they're afraid of stopping smoking in this example and gaining weight. What would you say to someone who has those concerns?
Yeah, that's a great question. It is a valid concern. People that quit tobacco tend to gain some weight. Usually it's the average of about 3 to 5 or 7 pounds. quitting tobacco is one of the best things you can do for your health. And tobacco use is the #1 preventable cause of death in the United States, second to obesity. And so, when the concerns of weight gain come up, which it does from time to time, a person would have to gain 100 pounds or more from quitting smoking to even have the effects that you would have from continuing smoking and not gaining that weight. So it's a huge, health impact on the benefits of quitting tobacco. And so I would encourage people, anyone, whether they're concerned about weight gain or not, to use some of the time that when they're working on quitting, to use some of the time that they aren't using tobacco to, increase their activities. And when you're working on quitting, your sense of, or your endurance, and breathing improves. And so that can entice you to continue on with, more activities to keep that weight gain at bay, and having healthy snacks around too.
Mm-hmm. So let's say you take a smoke break a couple times a day at work or at home, say on the weekends. Instead of doing that, maybe it's a walk around the block.
Yeah, exactly. Yeah, get some fresh
Okay.
air, take a walk around the block. Um, Deep breathing is a great, exercise to decrease your stress and get more
Mhm.
oxygen to the brain, and deep breathing without smoking. So,
Right.
yeah.
Maybe a path to success for those people who are worried about weight gain or who have experienced some weight gain in the past when trying to quit. Maybe it's replacing that habit with a healthier habit, one
Yeah,
that gets them active or
exactly. Yeah. Because when people are using tobacco, depending on how much they're using, they're spending a fair amount of time throughout the day smoking or vaping or using spit tobacco, whatever their form is. And so fulfilling that time with other things is going to be important. And a great way to do that, to also relieve stress, and it's great for everyone to be more active anyway, would be to, yeah, replacing that time of using tobacco with, a walk, or it doesn't always have to be activity either. I mean, I always encourage people to, read or journal or write or do a word search puzzle, or, finding those other things to fulfill their time that they've usually, done with, or usually have used with using tobacco.
Mhm.
So, um, finding, if they have hobbies, continue those. And I always encourage people to find new and different hobbies. And, they may or may not like it, but at least you tried it, and you might discover some other, activities and hobbies to continue with.
Well, and it's always fun to learn something new, and it's exciting, brain kinda lights up.
Yes. Yep. Exactly.
For someone who is considering quitting, or maybe they have quit half a dozen times and, they need some help, what's out there?
Yeah. So, well, within Columbia Memorial Hospital, I do have the individual face-to-face or phone appointments available. There's also some great resources online. Um, becomeanx.org is a good website. There's also the Quit line. It's in all 50 states. It's a free service. It's 1-800-QUIT-NOW. So that's 1-800-QUITNOW. There's also tech support out there also. So many options available for quitting, and most insurance covers these things because it's cheaper for them to do that than to have people continue using tobacco. So ideally what you would do is you would treat the addiction and habit together. And ideally if someone's open to it, which most are, you would use a nicotine replacement therapy, which is the fancy phrase for there's patches, there's nicotine gum, there's nicotine lozenges, there's nicotine nasal spray. There's also a nicotine inhaler, and then Chantix and Wellbutrin that are available or can be available to assist with quitting. And you would use one or sometimes more than one of those to assist with the addiction piece. And then talking about the whole habit piece, behavior changes, changing your routine, fulfilling your time with those activities and those things that we, just discussed would be the ideal setting. And like you mentioned, the average person's seriously tried to quit like 9 to 11 times. And so it takes time. It's a process. It's not going to happen overnight. There's going to be probably some slip ups and roller coaster rides throughout there, but I would just encourage people, to continue trying. And it's never too late to quit. And the benefits you see are quick.
Where do you think people tend to get hung up? Does it vary by person, or what seems to be the hardest piece of it?
It certainly varies, but I think the main hang up is with the habit piece. Because if you are using medication and you're using it correctly and you're on the right dose, then you're really not going to go through nicotine withdrawal. Unfortunately, that doesn't mean that you're never going to want to use tobacco again, because the habit piece is so, enthralled in that. So keeping yourself busy, keeping your hands busy, is also recommended, meaning, maybe having a pen, pencil, a paper clip, a worry stone, a stress ball, a piece of gum, maybe a little sucker, having those things on hand to replace just even the habit of having, a cigarette or a vape pen, in your hand when you're used to having that. Also, if you have a specific place where you smoke, like if you're not smoking in your home, but you go out, for example, on your front porch or back deck, ideally, at least initially when you're working on quitting, if you can, try to avoid those areas as much as possible, if you can, because you associate with those locations without really thinking about it. If you're spending your time, for example, in the backyard smoking, and that's where you use tobacco when you're at home, then avoiding that area as much as possible, just because the association piece. So I would say that the habit piece is probably the biggest barrier for most people.
Okay. Well, it seems like for people that I know who have successfully quit for for long periods of time, they had a good reason, and they had motivation. It wasn't just sometimes it's health if somebody's had a health scare, but in my family, it's been I want to be around for the grandkids.
Mm-hmm. Yeah,
Do you
that's a
find
big
that?
one. Yeah.
Yeah. What are how does somebody, I guess, identify or keep that motivation top of mind?
Yeah, and people are gonna, like you mentioned, want to quit or consider quitting for various reasons. A lot of times, yeah, it is the grandkids. Sometimes it's their pets. Maybe they smoke in their home and car still, and their pet or pets are being exposed to second, third-hand smoke. So many various reasons why people want to quit. Health, is a huge piece as well as saving a ton of money, which all adds up from when you're quitting and working on quitting and not buying either as much or not at all. If you're totally quitting on the abrupt quit approach, then you're saving a lot of money on not buying tobacco products as well. So various reasons, I think, and people also need or should be wanting to really quit for themselves as well. I mean, you can quit for other people and your pets and to live longer for your grandkids, but hopefully it's something that they truly want to do as well.
Mhm. Well, you mentioned the abrupt approach, which like a little light bulb went off in my head and I went, oh, wait a minute. There's different ways you can do this?
Well, actually, yeah. And that's the beauty of these one-on-one appointments that I provide is, figuring out a specific treatment plan for each individual, which is going to be different for every person, for what works. And so the abrupt quit approach prior to, probably a few years ago or so, is how I was trained, which is you set a quit date, you stick to that date. If you're using medications like the patch or gum or any of those other items, you would start it that day, or some medications you start at least 7 to 10 days prior to quitting. But anyway, so the abrupt quit would be, you set a quit date and abruptly quit. You get rid of your tobacco products the night before, you clean out your car or home, prior, if you still smoke or use tobacco in your home or car. And now, over the last few years, I was introduced at one of the conferences that I attended on the gradual quit approach. And that can work, a lot better than the abrupt quit for some people. And it's, each individual person's can decide on that. So the gradual quit, hence the name, would just be gradually quitting. You're still, if you're open to it, using medications like the patch gum, lozenges, nasal spray, inhaler, Chantix, or Wellbutrin. You're still using those, but you're actually still, in addition to that, you're still using tobacco at the same time. Some people, especially a few years ago when this was a newer concept, would get freaked out about that. But it is recommended. And if you are doing the gradual quit approach, if you're on a nicotine replacement therapy, like for example, the patch, but you're still, we'll just use cigarettes as the example, you're still smoking cigarettes, by being on the patch and staying on the patch, but you're still smoking, you're going to naturally decrease the amount that you're smoking, because you're going to be getting a fair amount of that nicotine that your body's used to getting from smoking from the patch as well. So you would naturally decrease the amount that you're quitting. If a person gets too much nicotine, they're going to get nauseous. That's not pleasant, but it's not the end of the world. So the gradual quit approach, can be beneficial and somewhat of a relief for some people, that they don't need to just, do this quit or this abrupt quit approach of, setting a date and sticking to it. Either way works. And that's just a preference that, when I meet with people, they decide. And if one doesn't work, then you can go to the other.
Okay, so it's like you don't have to go cold turkey. You can step it down, but really flexible. Find what works.
Yeah, exactly. And, speaking of cold turkey, I wouldn't recommend that. A cold turkey meaning, you abruptly quit all your tobacco products and you have no medication, no, assistance or counseling or support, has like a 4 to 7% success rate. So people sometimes know people that quit cold turkey. I always encourage them, not to compare themselves to, to that person if they know somebody, because it's very, very, small chances of success, over a longer period of time, versus getting the support, using the medication if you're open to that, and continue working on the process.
Let's say we've got listeners out there who are tobacco users and they are inspired to go for it, for the Great American Smokeout. November 19th, was that the date?
Yes, November 19th.
Okay. What's one piece of advice you'd give them?
To have their Great American Smokeout quit date be the November 19th be a quit date?
Yeah, if there's, whether it's that day or any other day, what's the first thing they ought to do to help themselves be successful?
Yeah, I would certainly have them talk or meet with myself and or their doctor, to look at options if they are open to medication. Ideally, you would have a treatment plan, a quit plan in place prior to that date. Start thinking about, why am I doing this? Why it's important? The benefits I'm going to gain from this? What benefits am I what benefits do I have continuing using tobacco?
Kind of a pros and cons sort of
Yeah,
thing?
exactly. Pros and cons list, and how you're going to keep yourself busy while you're working on quitting. And
Mhm.
if your initial plan is just to quit for the Great American Smokeout, specifically just for the 19th, just um, staying busy, having those tangible things in your hands like a pen, pencil, paperclip, worry stone, a piece of gum in your mouth, staying busy with those, avoiding the smoking areas as much as possible, and just continue at it and pursuing it and reminding yourself why you're going to do this and the benefits you're going to gain from working on this. Like I said, it's a process and it takes time, and there's ups and downs throughout that process.
So you have to be kind to yourself.
Oh, for sure. Definitely. Definitely.
Yeah. Well, thank you for joining me today.
Yes, thank you for having me.
Thank you for joining us today. I'm Felicia Struve, and this has been an episode of Hands on Health, brought to you by Columbia Memorial Hospital.